With city officials and residents pushing hard for a level 3 withdrawal management facility in the Soo, a drug action plan has been implemented. For the first time, the public was welcomed to Algoma Public Health to learn more about the new plan, which saw over 60 recommendations that included 11 priorities for the community. Drug Strategy Coordinator Charles Shamus held a media scrum following that presentation.
You talked about people will be able to track progress on
Yes.
these priorities. How is the website going to do that?
Well, we will have all of the priorities listed there, but then there's 62 recommendations. We're not going to tackle number one and then number two and number three. We're going to go after the ones that are most important right now and that the community and the community of service providers can tackle. So we may do number 13 and number 27. Those will be turned into a work plan. And so there'll be a smaller subcommittee. Let's say one of the things we're going to do is try to increase access, timely access for youth to treatment. So we'll get the youth service providers into a subcommittee, and then we will have a work plan to do that, and that will be on the website.
You're saying you're not going to go in order. You'll go as the priorities are.
Yeah, and we'll also, frankly, go if there's funding available for that thing, then we'll go for that one.
Okay. Well, what's the timeline? When are you hoping to touch on all these 62?
Well, over the next number of years, but we've already started. So there are 6 or 7 projects that we're in the early developmental phase, including anti-stigma discrimination training and campaigns, including timely access to youth to treatment, including a more robust and evidence-based education program for youth in terms of their resiliency and their strengths. We're looking at a mini project in Garden River for their community. That's it for now.
How many people did you talk to? Did you interview as part of this call to action?
Dozens. I didn't do that. That was Natalie's job, but certainly there were 30 plus service providers and then dozens of individuals, as well as many of the drug strategies around the province, because almost every community has one. And so each new drug strategy builds on what others have done in the past.
And those individuals, are these family members who lost a loved one? Are they people
Yes.
who use?
Both. Family members, people with lived experience, clients of agencies, service providers at the front line.